Hi, my name is Samantha Klein. I am the head nurse at the Methodist Assisted Living Home, and we would like to give you some information before you join our facility about the virus called shingles. A lot of our residents have shingles, and we want you to be aware of what the illness is and how you can prevent it. Shingles comes from a herpes virus called varicella zoster virus. This is the same virus that causes the chickenpox. If someone has had the chickenpox, the virus lies dormant in the sensory nerves close to the brain and spinal cord and may remain there for years. Infection with this virus begins in the mucous membranes of the respiratory tract. It then travels to the liver, spleen, and lymph nodes. Certain factors such as stress, having a suppressed immune system due to illness, and aging can reactivate the virus in 15 to 20% of patients. This virus is highly contagious, and those infected should avoid being around pregnant women, small children, and those who have never had the chickenpox. The signs and symptoms of shingles include a skin rash that can cause itchiness, numbness, a burning sensation, or intense pain. And after about 2 to 3 weeks, the scabs formed by the shingles will fall off, and for most, there is no further pain. This is a picture of the shingles virus, and it looks like they have some blisters that have scabbed up and some that maybe have not formed scabs yet. About 20% of those who had chickenpox as children will develop shingles as adults. Shingles usually occur only once in each patient. About 4% of those will have a second episode of shingles. This is showing chickenpox in a child, and then as it lies dormant in the body, it goes through the latent phase, and then as the shingles arise later, this is showing the rash that will arise if the chickenpox virus is reactivated. There are certain complications that can arise from having shingles. Some are that the painful symptoms can last up to years following the first shingles episode, and that is a condition called post-therapeutic neuralgia. Patients could have neurological problems, encephalitis, which is inflammation of the brain, hearing or balance problems, facial paralysis, or blindness. And blindness is usually if the person has shingles in or around the eye. It can cause permanent blindness. The localization of one side of the body being affected, as well as an antibody test to confirm the varicella zoster virus, makes diagnosis possible for physicians. Treatment for shingles involves bed rest, the use of an antiviral drug called oral acyclovir, and wearing loose-fitting clothes. Many people complain about a sensitivity to clothes where the shingles lesions are. So if they wear loose-fitting clothes, then there's less irritation in that area. Prevention of spreading shingles is difficult because the virus spreads before obvious signs of the virus appear. So the CDC recommends that the shingles vaccination for those 60 and older be taken seriously, and that is our request to you as residents coming into our facility, that you would highly consider getting the shingles vaccine to protect yourself and others. We can't wait to meet you all, and hope you have a great day. Thanks.